So our speaker tonight is Dr. Gladden, and he is a representative from MedVet, and he's going to be talking to us today about emergency medicine and critical care. So I'm going to go ahead and turn it over to you.
Welcome. Dramatic pause. More dramatic than I intended. So probably apropos for what I do, in that awkward minute that we were all like, ugh, does he know what he's doing? I'm not an expert in AV, I'll admit to that. But sometimes that minute that we all were there in that moment of silence is all that I get to have sometimes to make a huge difference. And I love that minute. I love that minute that's right there between life and death. For a lot of people, probably prior to me being a critical care specialist, I didn't think much at the time. Probably for most of you, seconds go by, unless it's a really long and tedious class, and then it feels like hours. And that's what I love about time, the perception of time, is that it slows down in those moments of chaos. And that's really, as a critical care resuscitation specialist, my favorite place. Because for some people, if you're the pet owner, this is your pet coming in the door, it's seconds. Your life is fine. You're walking your new puppy, you're loving life, you're chasing a squirrel, and then a car hits them. And your life changes, right? In a second. And those are the cases that I get to see as a critical care resuscitation specialist. And I have to, walk that line with life and death with those clients. And sometimes that's certainly challenging. But it also gives us a great opportunity depending on the kind of person that you are. So not everybody likes critical care resuscitation medicine, and that's okay. I have some great colleagues that love skin, not my jam, that love other body parts, that love hearts and brains, and we all kind of work together. But for critical care, really the jam that it's exciting for all of us is that it's very touch and go, it's very in the moment. And that's about as long as my attention span is. So it works out well for me. My slide of answer, I'm so disappointed if this is the piece that we're going. I can't really stand behind a podium, so we're gonna have to see if I can get this to work, because I don't want to stand back here. Oh, there we go. All right, just need an adjustment. So part of being a critical care specialist is sort of knowing your strengths and weaknesses. So if you're the kind of human that when there's chaos and things are happening rapidly that you panic, well, this may not be the exact ideal specialty for you. Some people are drawn to it. So I'm admittedly an adrenaline junkie, which is why I'm drawn to it. But you do have to keep your calm. And so one of the things that being a critical care specialist trains into you is to remain calm in the chaotic moment, because you're the team leader, right? I've got a whole bunch of nurses around me that are going to help us resuscitate and stabilize these patients. And if I'm not calm, they're not calm, we all don't do a good job. So there's a great saying from the Navy SEALs, which is slow is smooth and smooth is fast. And that is exactly how we work in critical care medicine. So we have to practice and slow down and do tedious things like practice CPR on dummy mannequins, which feels really goofy while you're doing it. Let me tell you, if you haven't done chest compressions on a stuffed cat and not felt awkward, right? That's sort of what we do. But we do those things, and I encourage you guys to do those things as you're embracing vet med and recognize it's a practice in medicine. So everybody wants to already be a superstar. You're not going to be yet. I've been a vet for almost 20 years now, and I'm still not done learning because it's the practice. And every day we have to practice, and that's the awesome part. So you go from sort of being in that calm space and practicing on stuffed cats to the real thing. And it's that same muscle memory that sort of helps us. So we have to stay calm. You can't be so calm that you're paralyzed, right? Like you got to do something in that moment. And that's where that muscle memory kicks in, and we get to be decisive and action oriented. And I think that's the part the adrenaline junkie in me likes. So this is a typical afternoon. This is my favorite scene. Like I walk into an ICU and there's this level of chaos and I'm in heaven, right? And I'm like, yes, we've got something to do today. My worst nemesis is a day where luckily fate has it that nothing dies, nothing's injured. And those are probably great days for those pets and their owners. but most of the time there's animals in need, and this is where I like to be. I like to be in the midst of it. So, this is kind of a typical day where we'll have multiple animals in an ICU that need care. And what you notice is I'm not standing in this picture by myself. Well, what this takes is an absolute team. I work with some amazing veterinary nurses and colleagues and other doctors, because that's what it takes. So if in your mind you're like, I just love animals, I want to be in a corner petting a dog by myself, vet med may not be for you, because that's not what it's about. It's actually far more about people than we probably give it credit for. So are animal patients absolutely the best patients? Yes, they are. Never seen a dog guts hanging out, wagging its tail. That's not a human, right? If our guts are hanging out, we're not happy about anything. And our patients are really great because they're super happy no matter what. But you got to absolutely love people, because you're going to work with a lot of people to do this job. And all of us that have pets recognize that animals come with their people. And for those people, right, it is their worst day of their life. So if any of you have ever had a pet that's been severely injured or ill, it is literally the worst day of our lives as pet loving people, right? And so you've got to take care of this chaos, which is the pets and the medicine. And I think that part becomes the easy part once you get the training behind you. Part of the hard part of my job as a critical care resuscitation specialist that took me a long time to get comfortable with is the humans, right? There's a lot of emotion. And so you have to work with people in a very short period of time, and they have to sincerely believe that you care about them and their pets for them to trust you, right? I have to go in a room and deliver tough news and say this is going to be really involved and sometimes very costly. And so I've got to have those people believe that I really do care about them. So I encourage you to, if you're not yet in that touchy-feely place with people yet, you just are in that place with the animals, expand a little bit to the humans because they come with it. One of the things that absolutely sort of drove me to become a criticalist, and I really want to emphasize for you guys that are at this place in your career, this is not a straight line. I was not sitting where you guys were sitting. I'm like, I'm going to be a critical care resuscitation specialist. My pathway didn't go that way at all. In fact, I became a specialist in the latter half of my career. So I've been a general practitioner. I've been an exotic specialist. I've worked in ER only. I've worked in ER private practice specialty. I've worked in university. I was a professor once of emergency critical care medicine and once of exotic animal medicine. I did ER for a few more years after that. And I thought, gosh, I can do what these specialists are doing. And I eventually did critical care specialty. So I was a very atypical path. You're going to hang out with a lot of vet students that say, you got to be straight A's, you got to go straight through, you got to do an internship and a residency, or you won't have the career you want. And for a lot of people, that's the path, but that doesn't have to be for all of you. So if your life has other things coming in and going out of that, what I like about vet med is once you've done it, right? Once you're in vet school, once you graduate from vet school, your vet degree lets you do just about anything. So eventually I became a criticalist because the common theme you'll see there is that I like to do a lot of different things. So really a criticalist, we have to be really good at a very broad, wide spectrum of things, because a lot of our colleagues that have narrowed their discipline on just the brain, my neurology colleagues or cardiologists that are focused on the heart, we're kind of the glue that helps hold that hospital together. So what makes a critical care specialist a specialist is I'm willing to take care of anything that's critically ill. Doesn't matter what you're sick from, doesn't matter why you're dying. My job, or my sort of passion, if you will, is to help take care of you. But I have a lot of broken body parts that are often going to be making that animal sick. And so I get to interact with almost every other specialist in the hospital, which is also why I really like my job. So we're pretty lucky as criticalists because we're at the center of the hospital and we get the benefit of the expertise of all these other people. So some days I get to wear my cardiology hat, but I don't have to know everything. I got a cardiology specialist that can come behind me and be like, yeah, you're right. This arrhythmia is what's going on with this patient and this is how we're going to treat it. So probably the most awesome job ever. It also sort of speaks to my love for doing lots of different things. I'm really lucky. You guys know I currently am at MedVet, and I think working for MedVet is tremendous because it's really sort of encourages that collaborative environment. So we get to have some of the best ER doctors and some of the best specialists working together. I have tremendous ICU nurses and anesthesia nurses, and we're all together and we get to get animals through all of this. And for really these really sick, involved cases, that's what you need. And you can see in some of these pictures I'll have, there's lots of people there. How many of you guys are familiar with The Princess Bride? If you haven't seen it yet, it's an important part of critical care culture in my mind. So some of the best lines that I will often speak on the floor that I get credit for have actually come from The Princess Bride. About 15, 20 years ago, I didn't seem as cool, but now people just think I'm coming up with these. But this is my favorite line in the movie, which is that mostly dead is slightly alive. And I love that because as a critical care specialist, I have to be an optimist. Most of my patients are in some stage of death, and that's okay. And there are times where I have to be a steward of death and say, like, dying is good and appropriate for this pet. Like, there are not things that we can do. But on many days, I get to sort of take that slightly alive category and bring them all the way back. And those are tremendous days, right? So we try to cheat death all the time. It's, as you guys all recognize, it's coming for all of us. And at some point, we'll all have a timestamp and a date that we're done. And that goes along with our pets. And I think what's probably hard is that we recognize that that timestamp for our pets is often shorter than our own. Not always, right? Like, we don't know what's going to happen as we all leave this room tonight. And that's not to be morbid, but just to remind you that life is short. And so really that slightly alive category is where we do a tremendous amount of good, because we've got animals coming in and they really meet the criteria of death, right? Their heart is stopped, they're not breathing. And there maybe if they're still warm, we've got a chance to take that slightly alive category. So part of being a resuscitationist or critical care specialist is doing CPR. And we do this a lot. For those of you who have seen TV, it's not always as successful as TV would suggest it is. So a lot of times with our ability to do cardiopulmonary resuscitation, we can bring parts of animals back. But the most important part to get back is their brain. So if we don't get full neurologic recovery back from these guys, that's not the pet that you knew and want to take home. And so a lot of times this isn't always successful, or it is, and then we have to make a different decision because the disease process that brought that pet to that, it's not something that is okay for that pet to sustain. In the simplistic parts of the critical care mind, it's like we do chest compressions. This is just like you've probably seen. You can probably Google this, how to do this. This is not hard. And we get an airway. And that can be as sophisticated as intubating an animal, doing what we call a tracheostomy, where we have to do an emergency cut down over their trachea and get emergency airway that way. And those are pretty exciting and pretty awesome life-saving techniques when we do that. As great as that sounds, sometimes getting an airway is just mouth to snout. And that's something that anybody can do at any point in time. So even though a lot of CPR looks really involved in the movies and on TV, sometimes the most basic things, we basically take over pumping that dog's heart or that cat's heart, and we just get oxygen in them. A lot of times that actually brings them back. So occasionally we need emergency drugs and emergency access, and a lot of that is helpful. But most of the time that we're bringing animals back, it's just because we're mechanically pumping their heart and breathing oxygen into them. But it's a pretty exciting moment when you do those things and you get them back. So there's a lot of different ways you can kind of see here. Humans, if you went to 5th grade CPR first aid class, right? There's just one way to do chest compressions in people. We're flat chested. What I love about our job is you can see all the different techniques down there. So if you're a bulldog and your chest is pretty flat to begin with, well, yeah, we're gonna do CPR the way they do on people in the middle. But otherwise, we have to make some decisions, right? We've got little tiny dogs and cats. The whole weight of my body doing CPR on them is probably going to be too much. So we've got like the one-handed technique. For bigger dogs, sometimes we're all sweating. And so doing 2 minutes of chest compressions doesn't seem like a CrossFit workout, but I guarantee you doing CPR on a 60 kg St. Bernard, most of us are sweating bullets. But the pump hard, pump fast will bring a lot of these guys back. And so really resuscitation or cardiopulmonary resuscitation is great. Every once in a while we have to do open chest resuscitation. So this is where the ante gets a little bit more real, because all of a sudden you're opening up a chest. You have to find the dog's heart. The heart is in a sac called the pericardium, which is essentially like saran wrap, and you have to take that off so that you can get in there and do open chest CPR. Occasionally animals that undergo cardiopulmonary arrest when they're under surgery, the surgeon will have to open up the diaphragm and reach across it and pump their heart that way. Because when they're on their backs in the middle of a surgery OR, we can't really do that. So occasionally you get to do this, and the first couple times you do this, it puts the hairs on the back of your neck up a little bit because you're like, wow, there's some important structures in here. But when we do get them back, sometimes doing open chest VPR, it's very exciting. And obviously, half the battle is bringing the animal back, and then you have to realize they're open, and you've got to figure out a way to get them closed. And some of the most exciting moments in my career when they came back and they're looking at you and your hands in their chest, and it's an awkward moment for both you and your dog because that doesn't feel real comfortable, but you have to be careful about what drugs you give them because they were literally just dead. Most of the time, we're going to do CPR, closed chest CPR, and that's usually very effective in the vast majority of our patients. But occasionally, like this dog in the bottom, this dog was a trauma case, and he had so much blood and air in his chest that the chest compressions wouldn't work to compress his heart. And so those are some of the instances that we have to do open chest CPR. But closed chest CPR is very effective, and we get to do that a lot. This is not just dogs and cats. So you can do CPR in many species. I don't think we have it perfected in birds. So one of the research studies I was involved with, we had pretty much a zero return or recovery on birds because their anatomy is so different. We're working on techniques to see if we can improve that. But most mammals, right, like a rabbit, guinea pig, chinchilla, you name it, you can do CPR on them. And sometimes we have to adjust the things, but one of the wonderful things about veterinary medicine, so we don't just have one species. So my youngest sister is a human doctor. So often we have to sort of compare ourselves, and I have to remind her that I don't just do one species, we get to do them all. So whenever your human doctor friends are giving you a little bit of a hard time, just remind them we're cool enough to do more than one species. I think the hardest part about CPR, and the part that never gets emphasized probably in movies and TV, is that when you get them back, you're not done. So a lot of times in movies, like people get back and they like sit up and have some Jello, and I'm amazed because right after you just die, you guys can imagine the blood flow to the organs, the consequences of not getting enough oxygen to your organs are pretty severe. So, this cat here was one of our post-cardiopulmonary arrests. So the cat was brought back, it had an anesthetic arrest. But you guys can appreciate there's a whole lot of things attached to this cat. And a lot of times, the hard part for people is I get to tell owners, yes, we got your cat back, we got your dog back. And now the hard part begins, right? So this is really where a lot of critical care resuscitation medicine begins, is that I have to sort of help every organ system that was deprived of oxygen and blood come back, or I have to treat the underlying disease that put them in that cardiopulmonary arrest. So for the geeky critical care part of me, this is where we get to do very intensive ICU care. There's a ventilator, so that's a machine that breathes for the animal. There's a million syringe pumps and IV pumps. So a lot of times the number of fluids and medications we have to give animals, we have to do multiple pumps to get that in there. There's a lot of intensive monitoring that we have to do to bring them around, and just generalized nursing care. So super fun part of my job, and really a lot of challenges as I kind of have to tease out how to get all these organ systems back up and running. Not as sort of cool seeming as the 15-minute success of the CPR. And so there's that rush, and then there's kind of this challenge that kind of keeps us mentally challenged in getting them back. There's also different kinds of resuscitation. So there's cardiopulmonary resuscitation, I think, that gets the most press. One of the other things that a critical care specialist does is we're kind of experts in what we call hemostatic resuscitation. And what that term literally means is that there are a lot of animals that are bleeding for a lot of different reasons, and we have to sort that out and figure out what blood products they need. So we're kind of the stewards of which products should be used and when. So unfortunately, a lot of animals, certain breeds are a little bit more profile than others. Like the golden retriever, I'm going to tell you some tough news tonight, which is that they get cancer really easily. Fantastic dogs, but we see a lot of cancer. So there are a lot of golden retrievers, German shepherds, some breeds like that will get bleeding cancers inside their abdomen. And you and I have no idea that's going on inside our dog when that tumor is just slowly growing, nothing's happened. And so many people get a surprise wake-up call some random point in their day where all of a sudden that tumor opens up and starts bleeding into the abdomen of these dogs. And so one of the most common reasons we see dogs that are collapsed and in shock is they have a bleeding cancer and they need hemostatic resuscitation. So we have to give them back that blood they're losing and get them stable so we can get out the bleeding thing. Occasionally dogs make bad decisions and will eat things like rat bait. And so some of the older rat baits will cause dogs to not be able to clot their blood and cause them to start bleeding just about anywhere. So those are probably two of the most common reasons we see dogs that are bleeding out. So you can see this dog here is being resuscitated, and There's this little sneaky red line here. This is IV, and he's getting rapid administration of blood to help revitalize him. This dog had a bleeding cancer in his abdomen, and so a lot of times we can help those animals and we can treat them urgently by taking out the bleeding tumor. But until my surgeons can get into the OR, I've got to get this dog back from its bleeding state of shock to a better state. So we get to sort of figure out how much blood, how much plasma, occasionally platelets that we give them. One of the cool things I get to do is something called an auto transfusion. So if you guys aren't familiar with this, those 2 bags of blood that are hanging there, we've taken out of the dog's abdomen where he's lost that blood, and we've put it in these bags and we're filtering it and we can give it back to them. And that's a really great thing because animals have blood types just like we do. And so not all animals can get blood from other dogs, so there can be complications from that. Cats especially have 2 different blood types. And if you're unfortunately a type B cat and you get type A cat blood, it instantly kills you. So we can't just willy-nilly say, oh, you're a cat, here's your blood. We have to either blood type them and figure out what they need, or occasionally give them back their own blood, which is safest. So a lot of times we're doing blood management, we're giving them back their own blood. Sometimes we're blood typing and figuring out what blood products we can safely give them. So we learned a lot in the last couple of years, and there's a lot of different ways that we can make the blood system happy. So sometimes we're giving blood products, sometimes we're giving something called plasma that helps them clot their blood better that they can get from other dogs. And occasionally we'll give them specialized medications that help them not break down clots as quickly. So of all the wonderful things I get to do, this is also very rewarding. You take an animal that's in bleeding shock and you fight the wrong combination of plasma and red blood cells and sometimes a drug called methotrexate, and we can often get these guys stabilized. And if they've just gotten into rat poison, they get to go home 2 days later on something called vitamin K, because that's all it takes to antagonize that. If they have a bleeding cancer, then I'm going to hand them off to my surgeons who are going to help take that cancer out. And then most of the time, they're going to have a pretty good recovery once we take the bleeding organ out. So what other kinds of resuscitation I do? So trauma resuscitation. In veterinary medicine, we're not so delineated in our specialty. So if you get traumatized as human, you'll go to a level 1 trauma center. And we do have trauma center designations in veterinary medicine that are just becoming a thing where we have centers, and MedVet has a lot of the things that we need to help take care of trauma patients. And so same thing, if you get severely traumatized, you want to be at a hospital where you've got all the specialists that can take care of that. So we get to do a lot of trauma resuscitation. Unlike human medicine, critical care resuscitation specialists like myself, we and my ER doctors, we do a lot of the initial trauma resuscitation where we're stabilizing these patients. And then we get our surgeons involved secondarily. So most often, dogs are traumatized by being hit by a car. Cats probably, that's kind of the second thing that they'll be traumatized by. And then the other big thing that we see for trauma cases is what we call DDLD. So you'll learn that we love acronyms, and you guys will learn to embrace these as a veterinarian. So that literally stands for big dog, little dog. What I like about little dogs, or Yorkies, I'm a little dog owner, I'm an Italian Greyhound owner, and I have big dogs, is that dogs have no idea what size they are, right? So if you've seen some of these fearless dogs that are about this big at the dog park, the like Maltipoo or the Puanas or whatever they are now, they'll often make the mistake of taking on a much larger dog. And the problem is that their body size fits inside the mouth of bigger dogs, and they can be crushed, and they can have bite wounds that go all the way through and puncture their lungs and their heart and their intestines. And so we see an awful lot of trauma from those sort of big dog, little dogs, as I would call them. Most of the rest of the trauma is dogs versus some, or cats versus some fast-moving vehicle, right? So the vast majority of those are what I call hit by cars, but we've seen hit by train, we've seen hit by boat, we've seen hit by golf cart. That's more common than you would think, where we see a lot of resuscitation. So as we take these patients in, and probably the biggest difference that you guys recognize is I don't always know what happened, right? I tell people constantly, because owners will bring us these animals that look like these 2 kiddos here. They'd be like, what happened? And I'm looking at them like, what happened? Like, I don't know what happened. So our patients can't talk. I would love to have a GoPro on some of these. And if you guys haven't seen the footage, somebody has a research project, hooked some little camera up to cats at night to see where they went. And it was amazing where they went. Like, so if your cat goes outside at night, they're on an adventure and they go places that you don't know. And so a lot of times, these animals are off, they get out of the yard, they escape, and they come back, and we don't know. So a lot of times in trauma cases, we have to just figure out what's broken by doing a series of tests. I can't ask them what they did. Did they fall? Did they trip? These two dogs here, this one came with an entire head bandage because he had blood squirting out of his head, and the vet that saw him before us panicked, and that's okay. Sometimes seeing a lot of blood is a panicking sort of situation. They just wrap the dog's whole head and just send him to us. Owner had no idea what happened. The other one there that has the big swollen eye, we sort of pieced together. He had the unfortunate deal is to get bit or stung, probably a wasp or a bee. And so his sort of presentation is an allergic reaction. We're going to treat that very differently than the fellow getting his head unbandaged here, who had true head trauma, had a big gash on his forehead and had sort of traumatized his eye, and there was a lot of bleeding from it. The rest of it was just fine. We still to this day have no idea what he did. But we still were able to kind of do a series of tests to figure out what's wrong and put them back together. So a lot of times I wish I could ask our patients what happened to them. Most of the time we have to sort of do some inquisitive investigating to figure it out. So of the more serious cases that we see, speaking of those two, is we certainly see animals with severe head trauma. The brain is a pretty important organ. It's well protected, right? We got a big, thick skull, and if you have never patted your dog on its meaty head, they've got an even thicker skull than we do, and a lot of muscle there, but they still sometimes make bad decisions. And so a lot of our trauma cases can have severe head trauma, and that's one of the times we have to think quickly and act quickly, because as the brain starts bleeding, or after the brain is damaged, starts swelling, not a lot of space in your skull, right? So it's great protection when you need it, but when the brain's swelling, we have to sort of do some things urgently to bring that brain swelling down, because as that brain sort of swells and gets more blood in it or more fluid in it, it's going to come out of the back of the skull, and we're out of time. So we have to kind of quickly do a series of assessments. And this is hard too. You've been to a human hospital anytime in the last 5 or 6 years, they come in, they're like, follow my finger, stick your hands out, stick your tongue out. Well, dogs aren't going to do that. So we often have to do a series of tests. So we have something called the modified Glasgow coma score, where we sort of flash lights in their eyes and we sort of see their ability to detect motion coming towards them, what we call a menace response. There's a normal response. So if you turn your dog's head, your cat's head, when you guys go home tonight, their eyes will follow. It's called like a doll's reflex, and that should be there. If it's not, that's often an indication of pretty severe head trauma. So we'll do a series of kind of light tests and other tests to figure out what's going on, and then we'll try to use that over time to figure out if their brain's starting to swell and if we need to do emergency treatments for that. One of the other big scary things that we see as trauma cases are things that involve the nervous system, is the spinal cord, right? So our spinal cord, our brain, they're pretty wimpy organs, and that if they're damaged, you're not going to get that to grow back. So a lot of times before we move an animal around a lot, we have to do some physical exam findings to detect there's a problem. I think most of you can sort of use your general sense of the world to recognize that something isn't quite right in this picture, right? So the dog's head is on this end. Let's see if I can do this on a dual sample. The dog's head's on that end. And this is his spine right here. And you can probably guess that their spine doesn't normally go up like that. So this fella here, right, had a complete transection of his spinal cord. So we have to do a series of kind of pinching their toes and checking some of their reflexes to figure this out when they first come in as a trauma case. Because if with this dog's spine, what you don't want to be doing is rolling them all around and picking them up and doing a lot of movement. So we use a combination of kind of our clinical judgment. Occasionally we have to use x-rays to sort of see. Now, what seems impossible to me is this dog, despite his vertebral column and his spinal cord being in 2 different hemispheres, actually was able to be put back together and made a full neurologic recovery with enough time and enough rehab. So there can be some pretty impressive injuries that they're able to heal from. And I think that's why I like trauma as a critical care specialist, because right before it happens, these are often happy, healthy animals. And in fact, it's young, enthusiastic, sometimes male because they're looking for an adventure. Dogs are more predisposed than some of the older dogs that get into these injuries. So they've got good young body parts and they can sustain a lot of trauma and still survive it. And so in some ways it can be devastating cases when we have injuries like this where they don't regain spinal function. Although if you haven't seen some of the cool wheelchairs, some little rolly carts that are out there in the world, there's still some options for those dogs. But a lot of times it's very successful. One of the greatest things that's happened probably in my career path in the last like probably 10 years is technology has gotten so amazing that we have ultrasounds now that literally fit in the palm of my hand. So the ultrasound that I use on a regular basis, there's this old model, Betty here, who I think is probably from more like 1990 something or the other, and still does a great job of letting us scan animals to find injuries internally. But my new ultrasound that I carry around literally fits in my hand and plugs into my iPhone. And so it's awesome for us because what used to be just a radiologist in a quiet room with these giant machines scanning to get information is now kind of in the past. And myself and my ER doctors, we can go up to these animals that are injured and immediately scan them on the bedside. And one of the great things for you guys as up and coming vets is a lot of this technology is going to be available so that when you come through vet school, you're going to learn how to do this. So doctors that probably graduated like 10 years ago are less comfortable with ultrasound. Most of my new grads are coming through. We've taught a lot of them how to do the scanning. And this is almost my second stethoscope. So a lot of people will say the stethoscope will probably be obsolete in the next 5 or 10 years. Because in many cases, instead of listening to dogs' hearts and listening to their lungs for trouble, I can now scan them with the ultrasound and I can find injuries that I didn't know about before. So we call it point of care ultrasound, or I'm gonna, for what you all call it focus, because that's our shorthand for it. But it's really cool. So this is a big part of what we do for any dog in the hospital. What I really like about focus is that it's low stress. So doing an x-ray requires me to put an animal in a weird position and be in a dark room and have us have heavy lead, gowns on. And I don't really love that. Point of care ultrasound, I sort of like to think of it as like this snuggly, low stress, relaxing thing. So this cat here is, I'm going to show you this video if it plays. This cat that I'm doing point of care ultrasound on is sitting on the table. I'm not holding this cat. This cat is just sitting on the table. It does have a little e-collar on, so if it doesn't really like what I'm doing, I don't get bit. But really all I'm doing is just sort of scanning a probe. And so one of the cool things about point of care ultrasound is that most patients don't mind us doing it. It's really tremendous asset to what's going on internally. And there's a big emphasis in vet med about low stress handling because nobody wants to take their already sick and injured pet to the vet and have fears that they're sort of being handled in ways that we wouldn't want to normally handle them. So point of care ultrasound is super cool. So this is one of the images that we would get from point of care ultrasound, which allows me to look at the lungs. So an animal comes in, it's severely traumatized. My nurses are putting catheters in, they're resuscitating it. They're doing a lot of things to stabilize that animal. And so a while ago, I'd have to wait till it was more stable to get back to the radiology room, which is a different room, take x-rays, and then bring it back. But nowadays, point of care ultrasound, I can just go up to the animal and start getting information. So a lot of our traumatized animals will have really bad lung injury. And so scanning to see if they have lung injury is super helpful. So I'm gonna orient you a little bit to this image. I'm gonna do it twice for people on that side of the room. So this top white line is where the lung is sliding by the inside of the chest cavity. Each one of these black, that look like little black shadows, are the ribs. So kind of think of your own ribs and the spaces between them. This is what normal lung looks like when we're scanning it. So on this side of the room, this white line here is where the lung and the chest wall come together and they slide by, and each one of these black bars is the ribs. And so I can scan that, and anytime I see this pattern, this is a nice dry lung, and I know there's no lung bruising, I know there's no fluid leakage in the chest, and I don't have to go take immediate chest x-rays on this dog, which is pretty cool. The other thing we tend to scan are their hearts. So in the circle there's something that looks like the mushroom. If you ask a cardiologist, they're going to tell you this is a parasternal short axis left ventricular view. Those of us in the emergency critical care world call this the shroom view. Not hard, right? So for many of our doctors, we look at this mushroom view, and if this mushroom view gets tinier and tinier, and all of a sudden the mushroom just looks like a sort of shriveled, kind of skinny little mushroom that's the walls are touching, that dog's left heart is very empty and that dog is in shock. And I know I need to give him more fluids or more blood products to help him. As that mushroom gets bigger and bigger and stops moving and sort of contracting, I know that I've either given too many fluids or that dog is in a form of heart failure called DCN, or he has poor contraction to his heart. So a lot of times now I can walk up to a dog that comes in shock, whether it's trauma shock or any other kind of shock, scan their heart, scan their lungs. We also do a belly scan to look for fluid, like those bleeding dogs we talked about. And in about 5 minutes, I can make a world of difference in terms of coming up with a diagnosis. So super cool technology, great part of my job that I absolutely love. Chest x-rays are still part of our life sometimes, but all of that information that I used to wait to get from a chest x-ray, like this picture here, I don't have to wait for. Occasionally there'll be things like rib fractures or things deeper in the lung that I can't see. So we still do chest x-rays. So just to orient you to these chest x-rays, the heart is the big white thing in the middle. And then on the either side, there should be 2 relatively black triangles that are full of air. You guys can kind of see from this picture that one of these triangles is not all black. So that's often what severe pulmonary contusion, so dogs that are had chest trauma and are bleeding into their chest, that's what it looks like. The black lungs that are full of air become more white as they fill with blood. So we can get chest x-rays to see this, or I also might be able to see this on my point of care ultrasound. And one of the many ways we sort of piece together what's going on with these trauma guys. One of the things I love about trauma is sometimes you never know what you're going to get. So as part of an ER doctor, I love the surprise value of this. Occasionally we have clients that call us and say, I'm on my way. So this client was like, I'm on my way, my dog's bleeding to death. And there's a lot of blood if you've ever clipped a toenail, if you've ever trimmed your guys' toenail on your dog while doing a nail trim. All of a sudden you're like, you feel okay about it, and then there's more blood in your house than you're comfortable with. It happens to all of us. So, you know, this dog as well, even though we got reports that he was bleeding to death and we were prepared for like a full emergency stabilization, had cut his pad and it bled a lot, but he was okay. And so we got a good kick out of it. You can see all the little bloody footprints. And for a lot of owners, this is traumatizing, right? We probably get a little bit too comfortable with blood and trauma and guts doing what we do. And so, you know, we still have to meet the owners where they're at. This was probably this lady's worst day, right? Still a lot of blood for people who don't see a lot of blood. And what I love about this picture is this patient, as you can see, like we still have the greatest patients. So here he was bleeding to death. He's like, all right. You know, like just as interested in my nurse as the nurse was trying to stop the blood and get a wrap on his foot. So we certainly see that. And then there's this character here. This dog's name is Maui, which is impressive enough as is. But Maui had the unfortunateness of being at a boarding facility when something happened with the dog gates. And Maui and another really big dog at the boarding facility came in contact with each other. Did not go well for Maui. So what was really sort of memorable about this case is that the boarding facility's name was Flying Fur. So when I first met this dog, as it came in a near-death state, they're like, this is Maui Flying Fur. And I was like, wait, is that his full name? Or, and his record until the owner came back into town said Maui's Flying Fur for weeks on end. So we got a big kick out of it. But Maui's one of those super amazing trauma cases that everybody told us, everybody I interact with in the hospital, and as we kind of went through this dog's healing process, no one thought this dog was going to make it because Maui's entire neck had been ripped free. So we got some important structures in our neck, right? We got our windpipe, pretty important structure, right? That was hanging in 2 pieces. We have the tube that goes from our mouth to our stomach or esophagus that allows us to swallow food. That also was completely shredded and not visible where it was. We have some very major vessels that feed our brain. So he had his big major vessels all kind of ripped away. And there are several nerves that run along our trachea, our windpipe, that allow us to open and close our windpipe. So whenever you swallow sometimes and you're and it doesn't work well, that's because your little doors of your windpipe didn't help you out. But what they should do is when you swallow, those should close effectively. But if that nerve is damaged, they don't. So Maui came to us, didn't have any trauma anywhere else, but the neck was, I mean, you just couldn't recognize anything in that neck. You know, and for us as a sort of critical care specialist, the first thing we have to do is get an airway. So it took us a second to find the airway. So even if a dog's tracheal windpipe is in half, you can still put the breathing tube that you need to in the bottom half. So we put it in the bottom half and we resuscitated him with blood and pain meds. We got him into the OR. Most of my surgeons said, I have no idea what I'm looking at. I'm not sure if I'm going to piece this back together. And I said, try. Because, you know, this owner and the boarding facility where he got into were very committed to trying to make sure this dog survived. So they pieced together the windpipe. That is actually not as hard as it sounds. And so we were able to get them a new airway. Most of the blood vessels they were able to sew back where they were. We weren't sure if there's nerves that open up his windpipe were going to work at all, but we were going to kind of take our chances. In terms of his actual airway, because the top of it was so swollen shut, we had to make an emergency airway. It's called a tracheostomy. So I don't know if you've seen some people, humans will sometimes have this where they'll have a little hole so they can breathe out of that. So dogs, we can make that same hole in their windpipe and just put a temporary tube down here when the opening was too swollen. So we did that for Maui. He was with us for several weeks with that. And then to get around the swallowing part of the story, you can put a tube directly in a dog's stomach. So this dog had what's called a peg tube. It's a tube that goes from his stomach out his side, and we could give him all his food and meds that way. And he was maintained with that tube for several months. And then the owner said, hey, you ended up having a permanent opening as windpipe called a tracheostomy. Dogs can have that and live just fine. They just can't swim, right? Not a bad, can't bathe them, swim them, because this is where you breathe. But short of that, and then the owner said, hey, it's been months. We haven't let him swallow any food or anything. Can we try? And none of us thought that the tissue remaining in the esophagus was going to be viable, but they did. And then the dog started eating and swallowing again. So just a super impressive dog. One, a good learning for how many structures are in your neck that we need. And so that horrible saying that you hear, right, when dogs go for the jugular, they do, right? Like that's that instinct that animals have when they're killing other animals, because there's a lot of structures that if you damage them here, as a predator, you win. So in Maui Gladden Fur's case, he made it through a lot of trauma. He was with us for many months. So a lot of the recovery, he was in and out of the hospital. But despite being a little dog, despite having a horrible prognosis, he still made it. And it's cases like Maui that make us still do what we do. Because are there a lot of dogs that have that level of trauma that never make it? Sure. And is that a lot of involved care, both for the owner to get through emotionally and for the cost of care? Yeah. But sometimes the right patient, they're going to pull through and make it. So absolutely love trauma because there's a lot that we can do. Sometimes it ends, in a way that it's not going to work for everybody. And we have to have those conversations. There are some traumatic injuries that are so hard on the animal's body and the amount of pain and suffering they'd have to go through to survive that isn't the right choice for those animals. And so we have to know that too. All right, move away from trauma for a second, even though that's the kind of thrilling aspect of what we do. Probably the more mentally challenging aspect of what we do that a lot of people are drawn to critical care medicine is that we're in charge of the intensive care unit. So just like in human medicine with an intensive care unit, we have really sick patients that need 24-hour monitoring. They need nurses by their side, or they're undergoing things like mechanical ventilation, which is a breathing machine for them that they can't have anybody that's not just a dedicated nurse taking care of them. And so those are the patients that come into our intensive care unit. These are what we call critically ill patients. So a lot of them look like this patient here, where we have to take over a lot of bodily functions. We have to do a lot of monitoring. There's a lot of what we call tubology. So there's going to be tubes, there's going to be urinary catheters and chest tube catheters and IV catheters and PICC lines and midlines and belly drains. And so they're going to need a lot, but with all of that care and support, we can get animals through a lot of this. So there are a lot of patients like this one that you can see. There's lots of lines of tubes and stuff here. So we have great ICU nurses that help us take care of these patients. We have a lot of ways to support them. So you can see a lot of these patients in some of these pictures have a tube in their nose. That's a feeding tube that goes to their stomach and allows us to give them nutrition. A lot of these guys, like this dog here, they're not going anywhere, right? Like we can't take them out for walks. And so they'll have urinary catheters to kind of help take care of them. This dog also has a belly drain in too, because he had some sort of major surgery. So it's hard because a lot of these patients require lots of intensive care, rotating. You have to kind of make sure they don't get that sores and stuff. But a lot of them can sort of pull through, but they're not going to just pull through with kind of typical nursing and support. We do a lot of oxygen support. So again, I like putting exotics in here because people always think of dogs and cats, but all the same procedures that we do on dogs and cats, we do in exotics. So here's a rabbit with a tube that goes from his nose that can provide oxygen. This is a baby llama known as a cria that it's got a tube in, so it's got a breathing tube in because we had been breathing for it because it was having difficulty with its pneumonia, breathing on its own. So it was on a breathing machine. And we're getting ready to take it off the breathing machine and let it breathe on its own a little bit, but it needed a little bit more support. So we can run sort of cannulas in the nose to give them oxygen to let them recover. One of our nurses thought this Korea looked a lot like a bunny, which is why there's the comparisons over there. A lot of times when animals just can't breathe enough on their own. So there are some conditions like heart failure, there are some bad pneumonias where, and a lot of us now because of COVID are probably familiar with this, where if your lungs get bad enough and you can't get enough oxygen saturation, that's a horrible feeling. A, you don't want to be awake for that. And B, there's only so much you can generate to pull oxygen into your body. And so a lot of dogs are like that as well, cats too. So this little puppy here had what we call aspiration pneumonia. So a lot of these beloved little short-faced dogs have some anatomical flaws, and that unfortunately allows them or makes them more predisposed to getting vomitus in their lungs and getting aspiration pneumonia. So we end up ventilating a lot of these patients. And so because they have a tube in and there's a machine that's breathing for them, that's helping their lungs efficiently take in oxygen, they need a round-the-clock nursing care, right? So we have to feed them. We have to make sure they can urinate with urinary catheters. We have to keep them asleep for this. So this puppy here required 7 different CRIs of drugs to keep it asleep, because as much as his little body needed the oxygen, they don't like to stay asleep, the puppies. So it required a lot of intensive nursing care, but very rewarding, right? We were able to breathe for him for a couple of days on the breathing machine and eventually wean him off and be able to send some of these guys home. So I think in a few minutes that we have left, I'll just talk to you about 2 other cases that I really liked. This is Zelda. A lot of what critical care specialists do is deal with internal infections that are very severe. So you can have peritonitis, which is where you have infection of your abdominal cavity, or you can have pleuritis, which is infection of your chest cavity. So Zelda had what we call septic peritonitis. This is a pretty serious condition that even after surgery, critical care specialists have to help manage their blood pressure, blood sugar levels. They need to be on a lot of supportive care. So what's amazing about Zelda is her primary issue she had was a joint condition where she had an autoimmune attack of her joints, and she was on a steroid medication for that. She belonged to a vet student. And if you guys don't know this about your future, if you own a pet, everything's going to be wrong with it because you're in this field. So set aside just a little bit of dollars for that happening. It's good that you have colleagues that will help kind of, make this more possible. But Zelda continued to have some vomiting, but was still eating. And so the owner was like, I don't know, maybe we need to adjust the meds. But when Zelda came in and we ended up recognizing that she had fluid in her belly and we took her to surgery, despite her good appetite, her last meal was chicken and rice, which is often what we feed animals when they're having GI distress. And unfortunately, her stomach ruptured. So her belly was full of rice. So if you guys have ever picked up rice that has hit the floor, you can imagine a whole belly cavity full of rice. So our surgeons had quite the task. So they had to flush Zelda's abdomen to get most of the rice out. I'm pretty confident there's probably still some pieces that were in there after the fact. And so there was a lot of inflammation and care that we had to do for Zelda. And so it's certainly going to be really challenging to take care of these dogs after surgery like that, because a lot of the side effects of all that inflammation from all that rice are pretty severe. This is Belle, so she has septic pleuritis. And you can probably guess Belle's hair coat doesn't normally look like this. So she's got bite wounds from her neck. She's got a special jugular catheter in all the way through her back end. So this is when I was up in Massachusetts, and the owner was like, what happened? And I was like, I'm not sure. She's like, I heard children screaming in my backyard, and then my dog came in like this. And this dog was covered in bite wounds. And I was like, this isn't a child. Like, no child did this to your dog. So I was like, this is definitely some sort of bite. And the owner was really sort of intrigued. So it turns out in Massachusetts, if you haven't been up north, there's something called the Fisher cat, right? This looks pretty cute, right? Like you're imagining it's gonna be like this, right? And jumping around like a ferret, which is what I first imagined before I lived in Massachusetts, because I grew up in New Mexico. But Fisher cats are about this big. And when a Fisher cat and your dog decide that they don't like each other, it doesn't go well. So I don't know if I have time to play it, but you guys should all go home tonight and Google Fisher cat noises. It's disturbing. It really sounds like children screaming or being killed by something. That's the noise this creature makes. So we were able to finally piece it together when we realized that this lady heard screaming children and her dog came in like that. So the teeth on these Fisher cats is tremendously large. And so unfortunately, because Belle had so many bite wounds over her body, those bite wounds got into her chest cavity and set up really severe infection. So she had what we call septic pleuritis, where her whole chest cavity had to be opened up and flushed because she had essentially pus growing in there. And so she was with us with some chest tubes and stuff. So, you know, a lot of times how dogs get to these places can be a mystery in and of itself. But eventually both of these dogs were in our ICU. They got really intensive care. So you can see lots of wraps and jugular catheter is what she has. It's a special catheter we put in the neck because all of her legs were chewed up, but we can't use any of the places where we typically put catheters in her legs. So there are some special catheters we can put in the neck. Zelda required very intensive care. The beauty of Zelda is a lot of really sick animals usually don't eat, and Zelda's appetite never failed. Like she woke up from surgery and was like, this is her like the next day. Like that's a treat in my hand where she's like, yeah, I'll eat that. Belle took a little bit longer. So you can see Belle got a nice sweater to make up for the shaving job we did. So you can see all her vitamins. The little tube that's in her nose is part of the nutrition that we were giving her to all take care of her. So, you know, again, if I have sort of one parting thing that makes critical care medicine really amazing is, you know, both of these dogs had a very narrow window where we thought we were going to lose them. Both of these conditions are, you know, quite severe. But that little bit of difference we make as a critical care specialist, that little bit of sort of support and sort of, it takes that whole rest of the village, the surgeons, the ER doctors, internal medicine. But really that little difference that we can make is a big difference to these owners because both of these dogs have to go home. And that, you know, for all the dogs that don't get to go home and the cats that don't get to go home is probably the most rewarding part of my job. So I love critical care. I love resuscitation medicine. I love my colleagues, and that makes it all possible. So each one of you, whether you want to do critical care resuscitation medicine, whether you like to be sort of think of yourself as a cardiologist, a neurologist, an oncologist, like you all get to work together on these really sick cases. But, you know, I can't say enough about picking this field. And so I know there's a lot out there about how tough it is to be a vet, and that maybe not everybody chooses that path because they know what they're doing. But I think for those of us that we've chosen well and we love it, I can't imagine doing anything else. And there's hard days like everybody else has, but it's one of the most rewarding things. So I think if you love people, if you care about people that love pets, I mean, think about it. Most humans for me, if you don't have a pet, they'll still probably like you know, but I worry about you, right? But I think no matter how different we all are as humans, one of the things I love about being a vet is I can walk into any room with a client, and no matter where we're from or what our backgrounds are, the fact that we both love and are excited about taking care of that pet in front of them brings us together. And so it's as much a people profession as it is dogs and cats. But I get to meet some of amazing people on their worst day ever, and they're very grateful for that, you know. So a lot of times the last thing clients say to me is that I hope I never see you again. And I don't take it personal, right? Because for all of us, we're hoping that their dog doesn't come back and see us again. But it's certainly during the time that we need to be together, it's important to have people that are willing to be with humans on their worst day. All right, so I'm going to stop there and I can answer any questions. I may not have the answer, but I'm willing to answer any questions. Yeah.
As a critical care specialist, how much surgery do you get to perform, if any, or does that pretty much just you triage it to the surgical specialist?
That's a great question. So there are several of my colleagues that are critical care specialists, but they also love surgery enough that they are surgeons as well. So you can get double boarded in surgery and critical care, or there's some critical care specialists that aren't even double boarded, but they like surgery enough that they do surgery as part of their job. So of the specialties out there, I think it's one of the most flexible ones because part of your training as a critical care specialist will include surgical techniques. So I was an ER doctor before I was a critical care specialist, and as an ER doctor, you often are cutting dogs with twisted stomachs, which are called GEDs. A lot of those dogs we're talking about that are bleeding out from bleeding tumors, you're going to cut those in the middle of the night, C-section. So a lot of that, whether you're a boarded surgeon or not, as an ER doctor and as a GP, you're going to do surgery. And if you love critical care surgery, you can see the trauma patient, stabilize them, do the wound care, take them to surgery, put them back together. So you can do all of it, which is really great. So, and I hope someday our specialty gets a little bit more involved where there's critical care that is involved with ICU and also critical care trauma surgeons, and that's where human medicine's gone. And I think people that really like trauma will do great as both the person that gets to cut the dog and stabilize them at the same time. Yeah.
Talk about like how you have to prepare blood, but if you have to do a transfusion, but like where do you get it from? Do you have it patients donated or how does that work?
Yeah, that's a great question. So there's a couple of different ways that are done like throughout the United States. So one of the things, there are groups that are blood banks. So just like in human blood banks, so there's groups or organizations. Sometimes it's a university, sometimes it's actually just a group of people that have blood donor dogs that'll come in. So one of the hospitals I used to work out before we blood donor program. And so that was animals that lived in the area, like OSU, probably their vet students, a lot of vet students, dogs end up becoming blood donors. So there's usually a combination of either commercial groups that will collect the blood from dogs and process it and send it out, or a lot of hospitals will have their own groups where, every couple of months, there's a group of dogs or cats that come in, give blood. We store it in bags and sort of distribute it from there. A lot of times, if you're in a practice where you don't have a reason to have a lot of blood go sit around, because really these blood bags should only be stored for kind of like 2 or 3 weeks max. There are ways to actually take a dog that's a donor dog, take blood out of it and give it to another dog right then and there. We're a little bit more fortunate with dogs. So dogs have blood types as well, but a lot of dogs will take a transfusion from another dog pretty well on the first try. Cats, like we talked about, not so much. And so there are cat donors, but we blood type them and make sure we understand what blood type they are before we give that blood to someone else. So a little bit of both, but yeah, it's a whole group of critical care specialists sometimes run their own blood banks. And that's definitely one of the things that you can do in this specialty. One more question in the back and I'll get to you.
As a critical care specialist, are you like always on call or like multiple colleagues always like ready to go and stuff like that?
There's different models out there. So like, for instance, right now, my other criticalist that I work with while I'm talking is taking my calls. But once I leave here, because I'm on one of my working days, I'll take calls on critically ill patients that are crashing in the middle of the night. There's a tremendous ER team there that handles a lot of those, that they have a great working knowledge on how to stabilize most of them. But if it gets really tricky, they're going to call me so that we can kind of talk through it and make sure that for the really tough cases, we have an action step. And then for my own patients, so if any of your pets were in ICU right now and I was taking care of them, same thing, I've got great ICU nurses and ER doctors that are my eyes and ears. We're pretty lucky because almost everything is digital. So right as I leave here, I'm going to go home and look at everybody's treatment sheets and see what's happened in the hour that I've been talking to you. And then I can call into my ICU and make adjustments for them. And my ICU nurses can do that as well. So last night, one of my patients started regurgitating and then breathing heavy. And so they called me and we made a plan to put that animal on oxygen. So there are some criticalists that have folks that take over for them. They don't take that call in the middle of the night. Myself, just because I think it helps me manage my patients better, I choose to take calls so that I can help support our ER team. But there are days of the week that I don't get called at all and I get to be just a regular human. Go ahead.
Going back to blood typing, in an emergency situation, how quickly are you able to blood type that animal and get them the blood they need if you're not using their own blood to deliver it back to them?
That's a great question. So for dogs, like I said, they're pretty forgiving. So in our hospital, we're very lucky. We have universal blood that can be given to any dog. So if a dog comes in urgently and is bleeding to death, I just go grab a bag and give it to that dog right there in that moment. If it's a cat, I still have to blood type it. Same thing, I'm lucky that I have donated blood already in my fridge. It takes about 10 minutes to blood type a cat and uses 1 drop of blood. So it's not hard for me, but I do have to do that step so I can pick which blood. We're also very lucky because our particular MedVet hospital that I work at is one of the few hospitals in the area that holds on to all the type B cat blood, which is the rare and more special blood. So I get to just go to my fridge and get that out. A lot of other institutions sometimes have to, if you don't have type B blood, because you can't give type A to cats, occasionally have to do something called a xenotransfusion, where we actually give cats dog blood. So every once in a while, if we have to do it urgently, it's safer for a cat to get dog blood if it's type B, if they don't have it in the fridge. So the typing process is pretty fast. For dogs, we don't have to worry about it as much for the first transfusion. After they've had one, then we have to figure out if subsequent bags are compatible.
Thank you.
So with respect to blood again, but do you actually have blood for other animals as well, or just dogs and cats?
In our hospital, because we only treat dogs and cats, we have dog and cat blood. You can do transfusions for other species. Ferrets are probably the one that we do the most blood transfusions in, the exotic species, because they have a number of conditions that require that. And ferrets are pretty awesome because they don't have blood types. So any ferret can give blood. The biggest problem is, if you guys don't recognize, most ferrets are about this big. So you can only take so much blood out of them. One of the cool things we had to do once is we had a ferret that had emergency surgery and was bleeding to death from a tumor, and it already had blood that one of the owner's other ferrets was donated, and they only had one other ferret, and then that ferret needed more blood. So we had to do a xenotransfusion on that ferret too. So it got cat blood, but it survived after it got the cat blood and went to live on. Birds, you have to be very careful. Like, you have to match their blood pretty closely with a close species, and that's harder because if it's a pigeon, some pigeon owners that have racing pigeons have tons of pigeons. If it's an Amazon parrot and that's your only parrot, sometimes we don't have that, and that's where it can get a little bit tricky. So, but you theoretically, as far as we know, you can transfuse most species. Some of them we just do it more often than others. I'm not sure it applies to horses and cows and stuff. I just can't speak to large animal. Yeah.
So I know you mentioned maybe it was difficult, like doing compressions in, like, let's say, 120-pound dog. You said it's also difficult in little dogs. What happens, like, when you're an equine vet or you're an exotic vet, you're doing an animal that's, several hundred pounds, or even worse, like an elephant, it's like almost a couple tons. Like,
Yeah.
Can you even like exert enough force, or is there even a lot of rigor on that? Like, what happens?
That's a great question. And that's the problem with our patients, is scaling it to size. So there was one time I used to work for a zoo, and we had to do an anesthetic procedure on a bear. And that was our big question. Like, I was like, if this bear codes under anesthesia, like, what is our option? And we didn't have one. So we came up with the best plan we could, because you can't, in a big like brown bear, you can't exert enough pressure to do chest compression. So we could have attempted open chest CPR. And I think for pretty big mammals, maybe up to bear size, you might be able to get enough compression. If any of you have seen those museum exhibits of those whale hearts, I'm like, yeah, So elephant, yeah, no way. I actually don't know if equine people have attempted CPR. I think they don't have much of a choice. I couldn't actually speak to whether they've done some open chest CPR. It's a good question. I know for pigs, because they've done a tremendous amount of CPR research on big pigs, there are actually machines, which sometimes they use in human medicine when they're doing pig research, that can exert enough force to compress a pig's heart, but it takes quite a bit of compression. So yeah, anything over probably in your mind, like a St. Bernard sized dog, you probably can't generate enough outside compression. For us, the really large dogs that are St. Bernard and bigger, those are ones that kind of give us pause, and we're like, should I do open chest CPR? Because that's probably the only way we're going to generate enough force. But like horses, I can't imagine that somebody can generate enough force to help them. So I think they're probably not as fortunate as I am. It's a great question though. Anything else? Well, thank you guys. I've enjoyed chatting with you. We've had a good time. We have a few parting gifts for you guys that we want to share with you. But, I'm looking forward to you guys getting to be vets. And then when you're in vet school, we have a lot of rotations and stuff. We're pretty lucky because Ohio State has a tremendous training program. And we get to share some of those. Next week, I have one of our fourth-year Ohio State students that is coming to hang out with us on critical care. So you guys get to do that as part of your future as well, where you can kind of come see, because that's one of the things, you may not know what you want to do yet. And I really encourage you going to spend time with this, specialists, with family practitioners, equine, large, small exotics. Because like I said, I had to change my mind about 7 or 8 times before I found something I really love. So just try it on for size. All right, thanks again.
Thank you. All right, guys, thanks so much for coming. If you want to stick around and have any questions, feel free to do so. Make sure you signed in for attendance if you haven't already. And then again, grab some vet swag if you want on your way out. I know we have scratch offs, bags, and a couple other things. So, yeah.
If you guys ask a question, and we can come see you because you're getting scratch offs.